This is Dr. Marty Rossman for The Healing Mind. I've been a physician for over 45 years, and I have been very grateful to have the practice that I have. I've met wonderful people. I've been able to help a lot of them. Of course, I've been sad because I can't help everybody, just like any physician or nurse or therapist. We do our best, and sometimes there are things and there are people that we can't help. But overall, I couldn't ask for more than the pleasure and the privilege, really, of being a physician that works with people at serious and important times in their life, births, deaths, illnesses, life crises, and so on. It's a great joy, really, when you're able to help somebody, and I think most helping professionals feel that. But there's a huge epidemic in this country of burnout in health professionals, of depression, of anxiety. The rate of suicide is much higher in doctors and nurses than in the average population, and that's a real tragedy. And so I want to talk to you about something about using your mind-body connection to help yourself if you're a helping professional. And a lot of this is applicable to you if you're just a good person that likes to help other people and sometimes feels like they're overextended, they're giving too much, they're not getting enough back, and you feel like you burn out yourself. And I call this talk, Why Aren't We Happier Helping People? So one thing to do, and that you can do at home, is just take a few minutes for a little bit of self-assessment. Just take a little time out, step back a little from your life, and ask yourself a few questions. One is, how healthy are you? And a real simple way to do this is on a scale of 0 to 100, where 0, you don't want to be at 0. 0 is very, very poor health, no resiliency. You're just on death's doorstep. You're probably not doing this or listening to this lecture. 100 is vibrant, ecstatic, plenty of energy, sleep well, eat well, active in your community, good relationships. You're just spiritually well on every dimension you can think of. So just take a minute and think, where would you put yourself on that scale of health and well-being if you were to rank yourself? Next question I would have you ask yourself is, how content are you? Again, on a scale of 0 to 100. 0, you're right in the middle of your winter of discontent. You are not content at all. 100, you're perfectly content. You just love your life. There's nothing that you would change. Where do you put yourself right now on that scale of 0 to 100? And then let's do the same thing with how happy are you on a scale of 0 to 100. 0, you're not happy at all. 100, ecstatic, you're bursting with joy. Just think about where you are. Don't judge yourself, don't criticize yourself. We're just calibrating to see where you are. How stressed are you on that same scale? 0 to 100, 0 is no stress at all. Life is just a bowl of cherries. 100, you're stressed out of your mind, you're crawling out of your skin, you can't sleep at night, your heart's racing, you have palpitations, drinking too much, smoking too much, whatever. Where's your stress level on a 0 to 100 scale? The next question is, how good are your coping skills? Where would you put yourself on a coping scale of 0 to 100? 0, I can't cope at all. I can't take another minute of this. I need out. 100, no problem. Stress in life, but I can deal with it. I can rise to the occasion. I can be creative. I can get help if I need it. I can increase my self-care. I'm coping pretty well. A big key to health and happiness is that your coping skills are considerably stronger than your stress levels. If they're not, we get upside down and we get in trouble. And then think about this question. How motivated are you to improve your health, your contentment, your happiness, your coping on a scale of 0 to 100? I don't want to change anything. I just couldn't care less. Maybe you're depressed. Or maybe you don't need to change. But 100 is, I got to make some changes. I'm ready. Let's go. Where are you on that scale? Okay, now that you have a starting place, let's talk a little bit about stress. Most of you are very familiar with stress. You know that stress is a physiologic response to danger, to threat, built into our body. Usually we call it the fight or flight response. This tremendous outpouring and activation of the sympathetic nervous system, pumping adrenaline into your blood, activating the big muscles of fighting and fleeing, raising your heart rate, making your blood clot faster. All these things help you survive an attack by a predator, like the iconic saber-toothed tiger. You know, you either run from it, or you kill it, or it kills you, and that stress response is over in 20 to 30 minutes. Then in nature, you'd go back into a relaxation response, and you would recover and replenish your energy. But of course, in modern life, stress isn't like that. It's more multivariant. There's many sources of it. They're vaguer. It's the environment, it's the government, it's politics, it's money, it's work hours, it's patients, it's family, and so on and so forth. Some of these things we worry about are vague. Some of them are imaginary. Sometimes we're worried about our favorite reality show figure. I mean, we take it inside. We set off the stress response in our body anyhow. It's working all the time, and so a lot of times we don't get the opposite, this relaxation response that lets us relax, lets the body go into a renewal, recharging, recalibrating kind of form, right? So we can live in stress like fish live in water and just not even be aware of it. We may just take it for granted, but the stress that healthcare professionals in particular go through, we're dealing with life and death issues. We have people that are needy and that are looking up to us for help. We want to help them. Most of us would not be helping professionals or healthcare professionals if we didn't down deep have some kind of desire to help. And my wonderful colleague, Dr. Rachel Naomi Remen, has often said, you know, there's something different about helping professionals. When something bad happens, when there's an accident, people get injured, people are in trouble, most people want to walk away from that. They want to leave the scene. They don't want to look at it. Typically, a healthcare professional or a helping professional will move towards that scene. And that's true for other caretakers too, like policemen and firemen and EMTs and so on. There's something in us that wants to move to a problem area and see if we can make it better. And thank God for that. And thank God for healthcare professionals. But there's a lot of pressure in our system. We are often asked to do too much in too little time. I personally, I have a very special medical practice. I do integrative medicine. I take a lot of time with people. I insist on having the time to get to know people. People often have to go into their pockets to pay me, which a lot of people can't do. And a lot of other people who could do that very easily are not willing to do. So many doctors are in a situation now where they have to see a certain number of patients a day. They have to make notes into an electronic health record. They have to diagnostically code people and take and choose out of 78,000 different diagnostic codes, the code that's most, or codes that are most accurate so the patient can get reimbursement from their insurance company. And they have to have billing operations and administrative operations and be very sophisticated business people because their reimbursements have gotten cut to shreds. And so they don't have enough time with patients. They need to see too many patients. They need to spend too much of their time. They spent their whole lives learning how to be physicians, and probably the majority of their time is spent doing administrative scut work. Really, that's really a waste of their time. There's a lot of forces with insurance companies, hospitals, healthcare systems trying to make doctors into technicians, as if people can walk in, you just make a diagnosis, you prescribe something for them, they walk out. You know, that's not really medicine. There's a lot more to it. There's the people that are involved. There are ways of encouraging people to help themselves. Most physicians don't have time to do that. And you know, recent studies show some very, very sad things, like over 60% of physicians would not encourage their children to go into medicine. Over 60% of physicians would not want their children to become a doctor. Now, I think that that's extremely sad because being a doctor is a very special thing. It's hard, but it's interesting, it's helpful to people. People rely on you at some of the most important times of their lives. You have special knowledge that you've taken years and years and years to develop. And so to be reduced to a pigeonholer and be under that kind of time pressure and really not get paid reasonably, people think, oh, it's a rich doctor. Not anymore. Not anymore. I've seen bills from surgeons for an operation like a hysterectomy where they got paid $75 from Medicare. I've seen bills for a well woman exam that was $154 where the doctor got paid $1.12. And that's after doing all this billing work and paying employees to do all that kind of billing work. It's a very bad situation. So you're trying to do too much, you're trying to see too many people, you have too little time, you're not able to do it well. It's a tremendous source of frustration. And it's not the nature of the work. This is true for nurses too. Nurses have a lot of record keeping, they have a lot of things to be responsible for, a lot of things to keep track of, and a lot of patients to take care of. And they're under a lot of time pressure too, more than is healthy for anybody, for the nurses or for their patients. The things we're dealing with are not minor things. These are serious illnesses, and they can be life-threatening illnesses. So too much to do, too much responsibility, too little credit, and too little compensation in many cases. There's a lot of scheduling and management issues that we're not prepared for. And we run into this situation where we develop compassion fatigue. We just run out. We've just cared too much. There's too many things to solve. A lot of times we're not able to do stuff. We get compassion fatigue. This is where you find yourself making bad doctor jokes, bad jokes about patients. I just can't see another patient. I don't really care. It's like one after another. The one is running into the other. You don't want to get up in the morning and go to work. Those are your signs. You lose your sense of humor. You lose your ability to sleep. You may find yourself more reliant on drugs or medications or alcohol. You know, there's not only a much higher incidence of suicide in medicine and dentistry and nursing than there is in the general population. There's also a much higher incidence of drug addiction and alcoholism. So people don't know that. And I'm sorry to scare people if they don't know about that. But these are difficult, stressful positions, especially when the forces that be try to wring every last drop of energy out of you without providing adequate support, credit, compensation, time to recover. There are a lot of family issues that especially physicians face, but other health professionals as well. But the classic doctor that people love, who spends a lot at the Marcus Welby, that spends a lot of time with their patients, they often don't have time for their families. It's very classic that the doctor's wife doesn't get to see the doctor very much, that the doctor's children don't get time to see them. To some degree, this is maybe less now with what I would call the corporatization of medicine. So, you know, being a doctor, going to Kaiser or working for a corporation, having a certain number of people to see in a day, not having to deal with all that administration and billing and coding and so on, having the right administrative support under you so that you can go in and see a reasonable number of patients, maybe a few too many, but not like you're trying to run a private practice. That's probably the future of medicine. And there may be a benefit in that because it's more like I go to work from here to there. I work hard, but I can come home and I can be off and I can have vacations and I can have weekends. That I think may be a benefit to doctors, and that may be a welcome thing. We're as prone to stress as anybody, and with a lot of these elements that I've talked about, maybe even more. And we worry about a lot of things. We have patients to worry about, as well as the usual things of finances and family and illness and politics and the environment and on and on and on. And, you know, stress is largely a function of our imagination. And we do a lot of education to try and help people learn how to use their imagination. This is very good for a health professional to learn, because what you don't want to do with your imagination is let it run away and run you crazy and come up with all kinds of things to worry about. Your imagination is a very useful survival function. It helps you anticipate danger. It helps you solve problems in advance. But it can drive you nuts if you just let it run wild. And we have a lot of educational resources to help you learn how to use your imagination, how to stop excessively worrying, how to stop creating stress for yourself that you don't need, and how to reduce your stress levels using your imagination. And the main question is, are you using your imagination skillfully and productively, or are you letting it run away with you? That's what you don't want to do. So real quick, Stress Management 101, there's a real simple way to think about it. If you're overstressed, there's only a few things you can really do about it. One, you can try to change your situation. Try to change the way that you practice, the location, the partners, or how you're going to practice. The second thing you can do is learn how to change your response to stress. And this is where things like philosophy, stepping back and coming to terms with these things may come in. This is where learning a relaxation response method and just taking a little time each day to put your body in a deeply relaxed, restorative state can really come in handy, just because you decide to. Just because you decide, okay, from here to here, call me if there's a fire, otherwise I'm kind of off the planet for 20 minutes. And learn how to breathe, learn how to relax your muscles, learn how to take your mind to a quiet, peaceful place with guided imagery, a directed daydream, and put your body into what we call a relaxation response, the opposite of the fight and flight response, a place where your body gets to refresh itself and renew itself and replenish itself, and get ready for the next round. So you can change your situation, you can change your response, you can change your perspective. You can get some counseling, or either with mentors or colleagues or a therapist or a group. You can think about it and say, is there some way to hold this and put it into perspective in my life that is not so as stressful? Am I making it more stressful by my perspective? It's easy to get into a state where you feel like everything is marshaling against me, you know, and nobody loves me and nobody cares for me and it's all not working well. Well, that's probably not true, but it's true if you decide it's true, and it's true if that's where your mind goes. So you may need to change your cognitions a little bit and find out what's really true, or find out a way to hold the truth that's at least as true as what you normally think and may work better for you. That's what cognitive behavioral therapy does. Another thing you can do to deal with stress is to cultivate hardiness. Stress hardiness is a quality of its own, and you can cultivate it. You can increase your hardiness. And what that means is, you know, do things that support you and that improve your health. You know, eat well. Make sure you have some time for exercise. Make sure you've got some time for your family and your loved ones, and your friends. Make sure you've got some time to just have fun. And make some time, now it sounds like there's a lot of time that I'm trying to take out and I already feel pressured, so you may not be able to do all of it, but think about how you're spending your time. You know, the healthiest of us and the luckiest of us might have 100 years here on this earth. Most of us have less than that, and none of us know how much of that time we have. And when you take that seriously and you realize we're just here for a short time, in the span of time, in the span of evolution, the span of history, the span of infinity, you know, we're a moment's sunshine. And we're here for a while and then we're gone. So how are we using this precious time that we have? How are we spending the energy that we have? and how much of it goes out to others and how much of it comes back to me. We don't want to be greedy. Health professional generally is not a person who spends an inordinate amount of time taking care of themselves, but the balance may need to shift a little when you're feeling depleted and drained and you're feeling like everybody's getting good care in my life except me. It's not going to be sustainable. It's kind of an ecological issue. So look at what helps you develop hardiness and get more of that into your life. So you probably know this, but the National Institute for Occupational Health and Safety has said that 75 to 90% of all visits to primary care doctors in the United States are directly attributable to stress and anxiety. Now that's a remarkable number, 75 to 90%. And we're ill-equipped to deal with stress and anxiety. A lot of times I think, I've been a primary care doctor, a lot of times I think the job of a primary care doctor is really sorting out what's not stress and anxiety, either from the direct effects of stress on the physiology, you know, the anxiety, the agitation, the nervousness, the indigestion, the rapid heartbeats, the high blood pressure, the high cholesterol, the muscle pain, the fibromyalgia. All of these things are exacerbated by high levels of stress. And we are very, very poorly equipped as physicians to help our patients who come in with this. And if 75 to 90% of them are coming in because of stress and anxiety in all its disguises, chest pain, stomach pain, headaches, neck pain, back pain, it's very stressful for us. We're not well trained in stress management, either for ourselves or how to teach other people. You know, when I give grand rounds to doctors, which I'm fortunate to be able to do a lot, let's say I have a room of 100 doctors, the very first thing I ask them is, how important do you think mind-body effects are in the health of your patients? And you know who raises their hand? 100% of them. And they don't wait and they don't look around to see who else is raising their hand. They just shoot their hands up. 100% of our colleagues think that mind-body effects are a critical factor in medicine. And then I ask a second question, and I ask them this. I said, how many of you have ever had any training or education so that you can teach your patients how to better manage stress? And do you know how many people raise their hands there? 2 out of 100. So we're seeing 75 to 90% of our visits, people who are anxious, people who are stressed. It's manifesting in all these different ways in medical complaints. And we are not trained to deal with it. We don't have the time to deal with it. And if we don't cultivate the knowledge or other practitioners that we can refer people to or get other resources, frankly, like we have at the Healing Mind, audio CDs, books, seminars, ways for people to learn how to manage their stress better, then that's just going to be overwhelming. You're going to have a lot of failure in your practice, and that itself is very, very stressful. So I can also make the point that even of the 10 to 25% that are not stress related, that stress amplifies and exacerbates medical problems, and it creates problems of our own that are often more difficult to deal with than the physiologic aspects of the illness. On top of that, people use a lot of what I call toxic coping to try to deal with the stress. They drink too much, they smoke cigarettes, they use drugs, either off the street or medical prescriptions that have their own side effects. So these are all methods of or they overeat or they eat junk food. And I think these are all methods of just trying to get through the day, just trying to be more comfortable, but they end up being toxic over time. So it's good for us to learn stress management because when we learn it, we can share it with our patients. Learn how to shift your attention. Shifting your attention in one way is the fundamental skill for managing stress. You have to shift from focusing on the various issues and problems of the day. It's hard to stop thinking. It's hard to slow your brain. A doctor's brain, actually, we typically have 2 to 3 times as many thoughts per minute as the average person. There's actually been research on that. How many thoughts do people have a minute? The average person has about 12 a minute. The average doctor has 40. There's a lot going through our brains. We're not the only people. Executives might have that, nurses might have that, mothers might have that, especially if they're mothers that are trying to work too. A lot going on. So when we're thinking that much, and we know that the brain uses 25% of the energy of the body, even though it's only, less than 5% of the mass of the body, that itself is stressful, and it's hard to stop that moving train. It's much easier just to shift focus. And the easiest things to focus on, one is your breath. Take your time to get your breathing deep into your belly and abdomen. It immediately starts to shift you into relaxation physiology from stress physiology. By the time you take half a dozen of those and ham it up and let your body relax, come to a still point, you can find you can relax in a minute or two. And the second thing is a guided daydream or guided imagery of just taking yourself in your mind to a place that's beautiful and peaceful and safe and restorative. Your favorite place, you may have been there in life, it just may be an imaginary place like floating on a cloud. All that's important are it's peaceful, it's beautiful, it's safe. Spend 5 minutes there in the middle of the day. You'll come back feeling not only more relaxed, but refreshed and ready for the next round as well. I find the Serenity Prayer tremendously useful. This is a prayer that's often associated with the 12-step programs, but it goes back to Roman times. And you can say it as a prayer, or you can just say it as a guideline. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And I've built a whole program around sorting out your worries, your anxiety, and your stress around that. What Viktor Frankl said, most of you know Viktor Frankl. He was a psychiatrist who was in concentration camps in Germany during World War II and wrote this amazing book called Man's Search for Meaning, which I encourage everybody who hasn't read to read it. If you think you're stressed, try being in a concentration camp for several years with people being tortured and dying all around you, no hope for escape. And what he says in that book is, forces beyond your control can take away everything you possess except for one thing, your freedom to choose how you will respond to the situation. Nobody can take that away. And he found that the prisoners in the concentration camps who knew that and who held on to their ability and to choose how they responded to the situation fared much, much better than those who didn't. So, look for sources of joy, look for sources of support, get your contentment level up, get your stress level down, get your coping level up, and see what you can do about those parameters we measured at the beginning. And take a look at this diagram. I use this a lot with a lot of my patients too. You see it, typically the midlife person, especially the midlife woman who is taking care of children, keeping a family together, may have a job on the side, has aging parents to take care of, has friends and networks that they want to keep solid, is involved in community activity. They are givers. They're giving. They also get very burned out. And it's very hard for them to turn inward and do something for themselves. I often use this diagram of the aorta. And the aorta is the big artery that comes out of the heart and takes blood to all 75 trillion cells in the body. Well, the interesting thing about the aorta, if you look at it, is that the very first little artery that comes out of the aorta, the artery that takes the first sip of that fresh oxygenated blood that comes out of the heart, are the coronary arteries, the arteries that feed the heart itself. So the heart that the whole body relies on beats millions and millions and millions and millions of times, and if it doesn't, nothing works and nothing else lives. And yet what it does is, with every beat of the heart, it just takes a little sip of the fresh blood off the top. It's not a pig, it doesn't take all the blood, but it takes a little sip of fresh energy every time it beats. And that's how it keeps itself healthy, and it keeps itself in a place where it has the energy to sustain the rest of the system. I think there's great wisdom in the way that the nature designed the aorta, and this may be a good image for you to motivate you to take even better care of yourself. So, thank you for listening. I'm Dr. Marty Rossman from The Healing Mind. I sincerely wish you good health and healing in every aspect of your life.